So I have the awesome Dr. Salina. We talked recently about her position.
Hi.
She knows the whole drill here. First, before you talk, Salina, you did something last night that is everything I wanted to do with Dental Nachos, everything. So someone said, I'm going to Dallas for my FAGD. Is anyone going to be there? And what did you do? What happened?
Well, it's Austin, but I said, who's going there? I want to connect. And I think we're going to get a nacho meetup in Austin.
That is what I live for. People meeting people through Dental Nachos. I may not be there, but you guys are going to have a nacho meetup. People were saying, can I meet you? Because I don't want to sit at the table by myself. So not sitting alone, Dental Nachos. You can always sit with us. It's such an important part of what we do and building this dental world. So I'm so glad you guys do this. Now, Dr. Salina, tell us, you've been on this show before. So tell us where your job is, why you're looking for an associate, and then let's go with what procedures they're going to be doing. So where your job is, why you guys are looking, and what procedures.
Okay, so we are located in upstate New York, specifically Utica, New York. It's a small city with a big community. It's me and my partner, and we're looking for an associate. And essentially, you're going to be doing pretty much everything that you are capable to doing, and then we can teach you more. But our end goal is to have my partner kind of be our in-house endodontist, because he is very, very good at, root canal therapy, way better than I am. I am more or less the surgical doctor. I do extractions and implantology, bone grafting, and we're working on elevating my skills into sinus lifts. We have so many patients. We are growing exponentially, and I really need a fire associate that wants to join a young, thriving practice and within an entrepreneur style culture. Awesome.
I love that. So I put this up here. So there's different toppings being done in your practice.
Yes.
Your partner likes this, you like this. Mm-hmm. So what did you do when you graduated from dental school? Did you go right to private practice, or did you do a residency?
I did a residency at the local hospital here because I really wanted to get in touch with this local community that I would be a private doctor for. And I actually learned a lot of my surgical skill set in that community and that patient population. So I didn't even like surgery until after my GPR. And then once I entered the practice with my partner, and he was like, I hate surgery. Every time I need to do something impacted, I'm sweating. And I'm like, oh, I'll do that.
Somebody eats guac and somebody eats salsa. Now I want to share value in helping dentists think in a different way. So there's a great question in the chat that says, at what point in dental school should I start applying for jobs if you don't want to do a GPR AGD? Now, I will share, my job in life is to kindly annoy people into good ideas. Sometimes my wife say regular annoy, but there are two dentists on earth right now, Randy and Alana, who did not want to do a GPR. They said they didn't want to do them. They met me. They came up to Philadelphia. I said, you got to do a GPR AGD. They say, Paul, we don't want to do it. I say, do it. Paul, you don't want to do it. I said, do it. So they did it. They're in their GPR now, and they said it was one of the best decisions they've ever made. So I totally get mindset shifts, but talk to this person and say, if you don't want to do a GPR AGD, why should they really consider it? How does it make you feel as a practitioner? How has it helped you make more money? How has it helped you feel better at yourself? Because this is why we're doing this. There's someone saying, I don't want to do a GPR AGD, and I want you to tell them why they should consider it.
Doing a GPR is going to expose you to a entirely different population that you may or may not see in your private practice, and force you to do everything in the scope of dentistry, because you are the main provider for that community, and you are in a learning environment where if you have struggles, you have plenty of attendees to help you, and you can develop as a doctor faster.
So pause there. You're perfect. But this is what I want to share, because I don't think people get this. Mm-hmm. I had a dad who was a dentist, and he said, go do a GPR because why can't you teach your associates in private practice the same way as a GPR? Where's the difference, right? There's two major differences, and I'll share mine because I'm attending at a GPR. Mm-hmm. And if someone says, I'll just work with a dentist in private practice, why is it different in private practice versus that GPR AGD?
When you are in a GPR, an attending is there for you for an allotted period of time, specifically for different procedures, so that you are literally scheduling with them. When you're working with the senior doctor, yes, of course, there's mentorship, of course, but it's totally different because you have to try to run and find them, or you're taking time away from production from the senior doctor to kind of hold your hand, or you have to stay after, or things like that. So when you're allotted having X amount of minds as well, you're learning from 30 different doctors at the same time, if you really think about it. And like we said, like a lot of dentists, we don't agree, right, on our treatment. So when you're able to compare, hey, Dr. X said this about this patient, and Dr. Y said this, and I'm Dr. Z, like this is what I think. And this is what works for me.
So perfect for number one. So number one is,
yes,
I go to GPR EGD. I don't have, I got a point right, my own 2-year-old to watch. So I'm a licensed dentist and I'm helping you with your 2-year-old. When I'm in my practice in Pennington, New Jersey, I got my own 6-year-old to watch and you have your 2-year-old. So I could be the nicest mentor on earth.
Right.
I can't stop my patient and go over and do your patient. I can help you behind the scenes. So that's why that year is so magical to practice in an environment with people there. And the second thing is, and this is totally unfair, when we had a child, they traipse in eight doctors to see my wife. Residents, chief residents, everybody look, what's going on? In a dental office, if you have to ask for help real time on your patient, even when you're being a really good provider, the patient loses confidence in you. And it's not fair, and they shouldn't. But when you can manage things after learning what you want to do and don't do, like you said, and you didn't even know you wanted to do surgery, right, Salina? Now you do it all the time. So yes. I appreciate you sharing that. Now back to your job. You're in Utica, New York.
Yes.
You are looking for someone full-time or part-time?
Full-time, and associate to potential partner. We're definitely open to the partnership for the future, because we definitely have room for it. So that's really important.
What can an associate, now you've talked about work-life balance and how you like to do things in the winter and during summer. Tell us about compensation. What range could people expect to earn? They came and worked with you and your team, just a range there.
So because we're going so fast, we definitely, a minimum of 150. And then at the top of that, it's really up to you, because if you want to work more, we'll make it so the schedule works more for you. If you want to work less, we work less for you. We're very flexible, because we work with our management company to make everything very efficient. So work-life balance, we do around 3 clinical days each, me and my partner, but we're kind of make it really efficient, where we layer some days and some days we're by ourselves. So there's definitely exponential amount of growth there.
And the theme I want to capture here is your dental career is a long career. Yes. Getting into an environment where you can learn from good people is something that doesn't show up on your money stat sheet. I know it's hard when you have a ton of debt and you say, I want to be on my own or do this. Learn from people who've been in this world, parenting patients for years. You may stay with them for 2 years. You may stay with them for 20 years, but that experience is great. So I appreciate Dr. Salina. How can someone reach out to you if they want to learn more?
So please, I will send everything in the chat, but you can text me, and I did my little righty thing. So that's my cell phone. It's 716-308-1891.
Oh, I love that. Take a picture of that. Leave it up for 1 second while you say that one more time.
Oh, shoot. I'm screening. I'm just like my laptop.
No worries.
716-308-1891. We are Buffalo grads practicing upstate New York. And if you want a great career and you're willing to relocate, we're right here for you, and we just expect nothing but growth. And I just need somebody with fire, because we're very highly motivated people. I graduated in 2016. My partner's like, I don't know. I think he's your age, right, Paul?
Yeah.
Did you guys talk about that?
2002 was me. So I'm 43. So
he's 42. Okay. Yeah. And like, he's awesome. Like he's as easy to talk to as I am. And he's super smart. Like I would not have partnered with him. And I was like, this guy just like knows what he's doing.
There's one thing I say that is hard to put into words. So when you're in dental school, it can be miserable, but you have friends.
Yeah.
When you're in your GPR EGD, you're learning, and it's really such a great year, and you have friends. Yes. It's very difficult to go into the real world and not have any dental friends. So when you could be in an environment where you work with Dr. Salina's partner and work with people who have your back, you might not see them every day. There's something so valuable to that. So if someone asks you to do a job at an office where you're by yourself every day, right out of a GPR, you have to remember that's a lot of pressure on someone who can't ask questions to someone there. So just to share there. So thanks, Dr. Salina. You're awesome. Appreciate it. Keep sharing in the chat. Can't wait to hear about the Nacho meetup in Austin, Texas.
Thank you so much.